Hello, TCMers, how are you doing? So today I bring you a really interesting clinical case from a patient that has been suffering from dizziness for the last 5 years. And we treat this patient with the four substance formula. So here we go. So first of all these clinical cases that I'm going to share with you in the next videos are patients that were treated in the first affiliated hospital from the Tianjin Medical University of Chinese Medicine in China, in Tianjin. As I just told you before, this was a patient that was suffering from dizziness, and we treat this patient with the four substance formula. Okay, so it was really interesting. This diagnosis is based on the 10 questions of diagnosis from TCM. So, I try to organize it in the most easy way for you to understand how we diagnose the patient and why we use this formula, because it's not really a common formula for dizziness. This patient was a female patient. She was around 32 years old, and for the past 5-6 years she has been suffering from dizziness. So every time she stand up like suddenly, then she felt dizzy all the time. Also, when her period was about to come, or when she was on her period, this feeling of dizziness get kind of strong. So she couldn't eat, and she felt kind of like weak all the time, and she was dizzy all the time. So she tried many types of treatments, and at the end she never got any results. She tried Western medicine, she tried Chinese medicine, and at the end she couldn't get any good results with any of them. It was really interesting because when the patient came, the main symptom of the patient, of course, was dizziness, and when you think about dizziness, you have to know what type of dizziness the patient is experiencing. But when the patient told us that she was having dizziness just after her period, like just when her period is going to come, or just on that time when her period is coming, then we knew that it's related with blood deficiency, and that's why we use this formula. Okay, so it's really interesting. This patient, first, she suffers from aversion to cold. Okay, so all the time she was cold, and she didn't like cold weather. Then, for example, something that was really interesting that we didn't mention yet is that also she has a bad digestion. So every time she ate, or maybe every time she was eating, she didn't felt that good. Okay, and she felt that her digestion was not the best. Okay. The second thing, she also was hearing loud noises, like what we call tinnitus. Is that she didn't have any other type of diseases before. She didn't suffer from anything else. Sometimes she experienced pain during her period. So the patient said that sometimes that she feel the pain, like dysmenorrhea, but was not every time. And the other thing interesting about this patient is that the patient also had insomnia. So there are a few formulas that we can think about, to treat this kind of patient, because she has blood deficiency, she's not sleeping well, and also the pulse was weak and thin, and the tongue was a little bit swollen. So when you think about this patient, maybe you will get formulas like on your head, for example, like Wei Pi Tang. You can think about formulas like Wei Pi Tang that can help us for this kind of problems. But also, this patient had a really bad temper. She was angry all the time. She feel her costal area. She feel like pressure on her rib area, And this patient, as I told you, was angry all the time, and then also she feel annoying, about everything. So so in that case, it's a little bit complicated, because in some way she has a deficiency, but in another way she's showing us that she has some symptoms of excess. Okay. So at the end, what happened? We have to remember that the main complaint of the patient was the dizziness. About the other symptoms, yes, they are important, and if we see it overall, this patient has a little bit from a lot of things together. Yes, but still, the main thing is the dizziness. So that's why we focus on the dizziness in this case specifically. Okay, because as I told you, we can use another types of formulas, but in this case, the patient came for the dizziness. Okay. And something really, really curious about this patient that I remember about it is that the patient told us that every time, 24 hours, every day, she felt that her neck, like her neck muscles, it felt really tense, and she felt a little bit painful, and more than painful, she felt uncomfortable, on her neck. So, like on the posterior area of the neck, okay? So in that case, also make you think that, this patient has a lot of things combined, like, she has a combination of a lot of things, and it's a little bit hard to give her only one formula. So what happened? Because this patient had dizziness, so as I explained in the title, we give her the four substance formula. So, and because I told you we treat this patient for deficiency of blood, we give these patients the four substance formula. Okay. So what happened? The four substance formula. So we are going to see here what we give her. Of course, we give her more formulas, not only one, because usually here in the practice we don't only give one formula. We prescribe most of the medicine. We don't use, for example, the pills or the balls, or like, I don't know how you call it. We use like the raw medicine, and we make the patient to cook it by himself, or in the hospitals they cook the medicine for the patients, but they have to drink the medicine. In this way you will get better results. The medicine like this is more potent than the pills, that you can eat as formulas. So in this case, we never prescribe only one formula. Sometimes there is only few cases when you just prescribe one formula, but we prescribe, for example, 2-3 formulas together. Yes, but there is always a main formula that is the one that is treating the main symptom of this patient. So in this case, the main formula was the four substance formula. So we have here Dan Wei, we have Shu Di Huang, we have Chuang Xiong, and then we have Bai Shao. Okay, so that was the four substance formula, and we see the grams of this formula were 12. Okay, in the main formula it says 10 grams. Okay, but in this formula we prescribe 12 grams to the patient. And also was really interesting. In this case, we add 10 grams of Huang Qin. Okay, we add 10 grams of Mang Jingzi. Okay, and 20 grams of Juhua. Here we have them in English, so if you want to check the pinyin of the herbs, you can also check, or we have it here in Chinese. Okay, so the basic formula, as I told you, was this four substance formula. And what else we also use this cinnamon twin decoction plus kutsu. Okay, so gugen, so gui chi jia gugen tang. Okay, it's really interesting because in this case we use wei chi inside this formula. Also we have bai shao. Okay, and then we have gugen, 20 grams. So it was really interesting because of the symptom that the patient told us that she felt that time. So she told us that her posterior side of the neck was feeling really tense, and remember that that's related with the Taiyang meridian. Okay, so seeing from the point of view of the Taiyang diseases, the best formula to treat the Taiyang diseases is with cinnamon twin decoction. Yes, but in this case we add gugen because inside the formulas, like the classic formulas, Wei Chi Jia Gugen Tang, this kind of formula help you to relax all the back muscles and the neck. So in this case, we added these two herbs. Okay, and of course, like up, we have also Bai Shao that is inside this formula. And besides that, the last thing we prescribed to the patient was like a basic formula. Like, we took some of the basics from Longdan Xiegan Tang. Okay, we didn't prescribe the whole formula. We only used 3 main ingredients from that formula that can take the heat from the liver. Okay, so in this case we have Longdan Sao 10 grams, we have Mutong also 10 grams, and then we have Chutsu 10 grams. So these 3 herbs together, they help you to expel the heat from the liver. So in some way, what was happening with this patient, seen from the point of view of physiology, like from TCM, So this patient, as we see, she was deficiency of blood, and she also was having a bad digestion. But why was happening this? This was happening because at the same time her liver was in excess. Okay, and in the theory of the 5 elements, we know if the liver, the wood, is like on excess, it will attack the spleen. Okay, it will start to affect the spleen. So in this case, the relation between wood and earth. Okay, So in this case, that was why we use these 3 herbs, okay? So to take down the fire of the liver, okay? And in that case, the spleen will not get affected. And remember, the spleen also is really related with the blood and the way we absorb the nutrients, and it's really related with deficiencies, okay? And especially deficiencies of blood. So in this case, you see, like, we use like everything together. We tonify the patient, okay? And also at the same time, we also use some expel techniques for the patient. Something that I forgot to mention is like this patient also was having a really bitter taste, like really strong bitter taste on her mouth. And besides, for example, to being angry all the time and hearing these loud sounds on her ears, like this ringing sound on her ears, that was why we prescribed it at the end, long again, okay? So the thing so at the end, what was the conclusion? The patient drank this formula for 7 days, okay, and the dizziness disappeared, like totally, So it was incredible because, of course, like the patient was experiencing this for like 4 years, and almost every day the patient was feeling dizziness. And of course, like after that 7 days, we continue prescribing the medicine to the patient. But in this case, we start to try other types of things because, as I told you, the patient have different types of symptoms. And after this, we use Weipitan. Okay, so for example, to treat the deficiency of blood, and also she has some insomnia problems and other things that the patient had at that time. Okay, but the main thing that we did was with this formula. So in the clinical case, this is a really good formula, for example, for what kind of patients? Patients that suffer from dizziness, patients that have anemia, and patients with dizziness due to blood deficiency, okay? If it's not blood deficiency, this formula will not work, okay? And there is another thing that is amazing and incredible, this formula. Patients that have headaches, but related with their menstrual cycle. So for example, the patients that are going to have, like female patients, of course, that are going to have their periods and they suffer from headaches. These headaches are related like 99% of the times on blood deficiency. So it's really, really, really useful formula. So you can try to use it in your practice. For example, if you have this kind of patients, especially for women. So what is the thing that this formula has that makes this formula so effective? The last 3 herbs that we have here. Okay, so Huangqin 10, Manjin 10, and Yuhua 20. So these 3 herbs together, they will go directly to your head, okay, like to the meridians. It is connected to the meridians that are on your head, and in some way also will help to expel, like to treat the blood deficiency, of course, at the same time, and it's going to try to expel all the pathogens that are inside the patient, okay? So this formula is incredible for dizziness, headache related or due to blood deficiency. So especially for women before their period, or women that after pregnancy, they are feeling from this kind of symptoms, okay? So at the end, just to finish, just for you to know, like this formula, the main characteristic of this formula, the main function is to harmonize the blood, okay, and tonify the blood, okay? And the characteristic that tonifies the blood, and secondly, it balances the blood. So it's a really good formula to be related with blood issues, so deficiency of blood. So this was the clinical case we had. I hope you can apply this formula as much as you want. Actually, in Chinese, this formula calls 加味四物汤. Okay, it's not only the 4 substance formula, but they add some herbs on this 4 substance formula. On these 4 substance formula, that are the 3 herbs that I just explained you, that work for everything that has to do with your head. I hope you really enjoyed this specific case we brought you today. If you liked the video, please give like. If you have any comments or any suggestions about the video, or you have any questions about the herbs we use or the formula, please leave a comment down below. And please try to share this video and subscribe to the channel. See you next time.